Have you been diagnosed with degenerative spine conditions such as degenerative disc disease or degenerative joint disease? Have you wondered if chiropractic care can be helpful, but you're in so much pain, you're concerned that chiropractic care might be painful? Don't worry, you're not alone. My name is Dr. Matthew Collins. I'm a chiropractor. I am board certified in rehabilitation. I'm fellowship trained in primary spine care, and I've been managing patients with degenerative spine conditions for decades in my practice. Now, these videos are not a substitute for medical or chiropractic advice, for a thorough evaluation, for diagnosis, or for treatment. These are strictly for informational and educational purposes only. This video is part 2 of a 4-part series, and in it I want to demonstrate to you just some of the simple approaches that we use for patients with degenerative spine conditions. Oftentimes, patients coming in with degenerative conditions, whether it's from a curvature in their back, such as scoliosis, or advanced degenerative disease in their lower back, they're in a lot of pain, and my heart goes out to these patients. Frequently, they struggle to get up from a chair, to move and go into different positions. And if you've ever been in that much pain, you understand how concerned you are that you don't want to make it worse. So, one of the things that we do here in our practice is we use some low force, hands-on treatment technique. In front of me right here is one of the pieces of equipment that I use. This instrument right here is an assistant for hands-on chiropractic adjusting. This instrument right here is designed to provide gentle, leveraged forces into the areas where there's mechanical spine pain at the areas of joint and disc disruption. And I want to demonstrate this for you. So, with this table, there are bars on either end. And these provide leverage. And with this instrument here, we can go in there and we can work on the spine. Oftentimes we have patients say, my back is in so much pain, I just wish somebody would pull me apart. Well, the reality is there is a type of chiropractic adjusting where the joints really are pulled apart, but they're done very deliberately and very gently. Let me show you on the neck portion. So this piece up here would be where the head lays. So the patient would be laying face down. We see the armrest here on the side. I hope you can see that in the video. And then down here is where the legs would be. Patient's laying face down. As you can tell, there's movable sections here, and you can see how this headpiece slides back and forth. So with the patient laying down, the spine can be lifted up, the joints can be separated, the disc space opened up, and the space where the nerves come out between the discs open up and the disc stretched. Additionally, side-to-side bending can be done. Now there is something with spine pain that is called directional preference. Directional preference is where a patient has pain that is relieved in certain directions and is provoked in other directions. So a really good chiropractor is going to do something that's called tolerance testing, and we'll go through, regardless of the diagnosis, 2 identical patients, both come in. Let's say they have a disc degeneration at L5-S1 in their lower back, but one patient is biased into pain going to the left, and the other patient is biased going into pain going to the right. You would avoid those directions. And you can bend and move the table. The same thing happens with the lower back. Different sections can be released. The table can be moved side to side to accommodate each individual patient, to accommodate their different pain patterns. Now, in addition to all of this, oftentimes following the adjustment, when the joints are adjusted, pain is reduced. Traction, where the joint spaces are opened up, can be very, very helpful. On this instrument right here, this bottom section can move. I'll demonstrate it right here. You'll see how that section pulls apart right there. That can be adjusted to different depths. So depending on the patient's tolerance level, depending on where in the low back the degeneration is, this table can be turned on for different depths, can be automated, and following an adjustment, the patient can undergo traction, where that disc and that region in that area is opened up and closed. And you know, the discs have a metabolism, and the metabolism is passive. That means that there has to be motion through that area so that waste products get pushed out, nutrients get pushed in, and there has to be this ebb and this flow. And when a joint becomes very degenerated at the low back or in the neck or even in the middle back, oftentimes the muscles tighten up and then that area doesn't move. So following a chiropractic adjustment in that area where we restore some motion. Adding traction that follows has been shown to decrease the pain levels, accelerate recovery, and oftentimes these patients have more relief following each and every single adjustment than they would had they had the adjustment only without the traction. There are other modalities that can be done, different things to do to reduce the pain, reduce the muscle spasm, and ultimately improve the patient. So I hope that you found this helpful. I hope this answers some of the questions that you may or may not have regarding, is chiropractic care helpful? Is it therapeutic? And is it painful? And I'll leave you with this. Consumer Reports. Now, it's not really a scientific agency, is it? But Consumer Reports has shown that chiropractic care has one of the highest satisfaction rates. Now, Consumer Reports is very important from one standpoint. Many, many times, patients will have identical looking MRI scans and one patient has more pain than the other. So oftentimes it's very difficult to track patients whether they're a good candidate for care, and all we can do is measure how they do afterwards. So satisfaction rates tend to follow pain relief rates. So rather than treating the anatomy that we see on the MRI, we treat patients. So looking at where patients are reporting, where they're getting their relief, Consumer Reports has shown that chiropractic care has the best, if not one of the best, satisfaction rates of any profession out there managing patients with degenerative spine conditions. You have many different videos to pick from. I'm honored that you chose this one. If you or somebody you know is suffering from pain coming from degenerative spine conditions, we are more than happy to help. Please give us a call. We'll schedule you, we'll evaluate you, and see if you are a good candidate for care. And until we meet again, be blessed.